Cynthia, and in this opportunity, I am going to introduce you to Dr. Norimune Kawai. He's the professor of the Hiroshima University from Japan, the head of Norimune Kawai's lab, Bachelor and Master of Education from Hiroshima University, Master of Arts in Speech, Language, and Hearing Sciences from the University of Colorado, Boulder, Doctor of Philosophy in Speech Language Pathology from the University of Nebraska. He has more than 30 articles about education, special education, and speech disorders such as stuttering. Welcome to this virtual meeting, and thank you for letting me share this time with you.
Yeah, thank you very much.
Well, I have prepared some questions for you to talk about stuttering.
Mm-hmm.
The first one is, do you think Japanese society consider that people who stutter have a disability or an impairment? Is there a negative social stigma in Japan?
Right, yeah. It's a kind of really big question for me, so I don't know, how well I can answer, but, well, there are so many, different perceptions towards stuttering, I believe. It could be depending on the generations. Older people might think, well, stuttering is sort of the habit of people, of speech or something. But well, this is related to your another question, but I believe older people tended to have, thoughts about, this is just a habit. However, this is also sort of the, like a bad behavior, or, it shouldn't be happen to people, when they speak or something. So, elder generations might be thinking, oh, okay, well, they have to fix it. They shouldn't stutter in front of people. And, when I work with, older people who stutter, many of them say, well, they used to be, made fun of their behaviors, because of stuttering, and they had a really tough time during school age or something. And also, some of the elder people tend to believe, well, they, mimicked other people who stutter. Then because of that, they start stuttering. So, they sort of have a, feeling of regression. If they don't mimic people who stutter, I had a different life or something. Some of them, still believe so. So, but the younger generations, their perception might be different from older generations. And because now our, laws and, legal aspects of, people who stutter, well, we don't really specify for people who stutter, but, stuttering is one of the developmental disabilities. And our law says, we are supposed to support people who have developmental disorders, and speech and language disorders are one of them. So that's why, there are school system, there are so many children who stutter go to resource room to get help from the special ed teachers. And they can also have access to speech language pathologist to get, see their stuttering behaviors and such. So younger generations, they know it is one of the disabilities, and there are some resources, they can go or access.
Yeah, I think that is very important. I believe that the more we know, the less the less stigma there will be. So, but this social stigma, I think that happens around the world in every country, and they are based in just how people who stutter talks without considering their message or what they want to say, their emotions they want to share. And we have a lot to learn as a society. Sometimes we are very impatient and we don't know how to listen to others, but that's the message we get. That's something we have to learn as a society to grow, to be more tolerant, to be more patient, and to listen what really matters, the message of the people, the message of the ones who stutter. Yeah. Okay. And another question is, as a professor and mentor of international students, you may have the chance to have a wider vision about cultural differences. I believe in Japan, there's a proper culture of respect and empathy. Do you consider that the Japanese people who stutter would experiment less discrimination compared with people from other countries?
Yeah, that's another big question. And well, actually, I really don't know. Even though I lived in the U.S. and Japan, and I also accept lots of students from over. I would say I have had students from different countries. I would say over 15 or 20 countries. But well, in fact, most of the international students I work with are not really interested in stuttering, unfortunately. Because I pretty much mentor them because they would like to study on inclusive education or diversity kind of stuff. So once I come back to Japan, I have been doing a sort of the special education, inclusive education. Of course, I have been focused on the studies on stuttering, but I have been doing other stuff. And yeah, most of the international students are really interested in inclusive education area. So I don't know. I really haven't really directly asked my students what the perceptual difference is of stuttering in different countries. However, yeah, as you say, yeah, cultural differences are also big factors to for people who stutter, if it is easy for them to live or not. And I'm not sure if Japan has proper culture. Well, maybe, but may not be. But at least what I can say is well, Japanese, well, like Western people say, Japanese are pretty shy. I'm not sure if we are shy, but we don't talk much, comparing to Western people, because one of the old sayings says, well, silent is gold. So it is really important for us to be quiet. Of course, we have we talk whenever we need to, but we don't really talk. And especially for the schools, of course, in a presentation, oral presentation is important, but we tend to value what they write. Writing and reading is more, we consider is more valuable than the speech, because writing, reading, lasts for a long time. So I think that kind of cultural differences, could be differences or values, might be causing some differences for people who stutter, if it is easier for them to fit in the schools or social environment. Yeah, because I've met many American people who stutter, and they had a lot of troubles or difficulties, because they really worried about when they are called on during the class time, or when they do the oral presentation. They had a really difficult time. But Japanese well, students, even though teachers don't call on them pretty often as American teachers, occasionally they do. So one, I think I have two feelings for how difficult for Japanese people who stutter attending schools or other social situations. So partially it might be easier, because they don't have to talk much comparing to Western people, but because of the limited opportunities to speak. When they get a call on, or when they have to give oral presentations or something, I think their fearness is much higher than Western people, because because of the limited opportunities to do so. So that's why it's kind of really difficult for me to make a comparison. Well, cultural differences could lead the how easy for people who stutter to live, but because of the limited opportunity to talk, in public, people who stutter, Japanese people who stutter, really, have a big fear, or they have a really difficult time when they know they have to do the oral presentations. I usually work with school-age children and adults who stutter as one part of my jobs, other clinical work here, our university. And usually, like college students, undergraduate, graduate students, especially undergrad students who are junior, because they start doing the workforce programs, or they have to do the oral presentation for their bachelor's or master's thesis, because they haven't had many opportunities to talk in front of people. They start working with me. They start contacting me when they become a junior or second year of master's students, and they like to have the how could I they always ask me, so how could I talk fluently or something, and they haven't seen any specialists before. So I think that's currently I have been experiencing a lot. So they haven't had any opportunity to see specialists until adult age or something. So well, I'm not sure if it is right on the track answer, but yeah. So
Yeah, I
and
believe.
yeah.
Oh,
Go ahead.
I believe we have many stereotypes, and yeah, I consider that we think, well, non-Japanese people think that they are shy, they don't talk too much, but I believe it depends on the person. But this can have some pros and cons if it's
Yes.
true. If it's
Right.
true, as you have said, they might be covered persons who covered stutter, no, that like I covered stuttering, and they will not have the opportunity to practice their speech in social situations and maybe with their friends or even in front of the class. So some things will maybe benefit, or I don't know if there are some advantages or disadvantages about it.
Right. So that's why, as a clinician, well, I believe, I have to be really flexible. Like, I used to have a high school student, female student, who can hide the moment of stuttering really well. So, she can perform really fluent speech almost all the time. But, she was really worried about the, tiny moment of stuttering. So, well, I would say, well, you can much more fluent than myself, yeah, she just talks and she just, blows me up, but she still worry about it. But, but there's another student, who is a, male student. I think he was a middle school student, when I work with him. He stutters a lot. He stuttered a lot. And, but he, well, I saw him for two years or something. And, finally he said, well, I'm fine. Oh, he had a stuttering, still he had a stuttering. But, the reason he wanted to, leave our clinic was, well, he just wanted to talk whatever he would like to. So, and he had a confidence with, his speech, even though he had a moment of stuttering. So he said, well, I could live with it. That's okay. I have stuttering. So, there are so many, people who have different, value or thinking thoughts about their stuttering. So, yeah, my job is, how I can fit with the needs and, how we can dig into the different needs or new value of the moment of stuttering or something. So, yeah, it's kind of tough question for me to, well, of course, cultural differences, have a big role, and, the big influence. I think it's going to be a big, factors, but also we also have to consider the individual differences and, what their thoughts about stuttering. Yeah.
I think that's the most important part. The thoughts, the feelings, what they feel when they are speaking, the confidence, if they say what they want to say, and if they are okay stuttering. So that's, I think this is the most important part in the treatment, to consider that what they feel. Maybe some people stutter very, very less or very little. They have just some disfluencies, but the impact, the experience is very high. On the other hand, no, more people, another person can stutter a lot, but he does. I don't know. He's okay with, as you have said before. He's okay with the stuttering, and well, in that case we don't know. Maybe we don't have to have to help him, or we don't need a treatment in these cases. And related to adults who stutter, some years ago you wrote an article about self-disclosure. And what are some of the outputs about doing this self-disclosure?
Yeah, well, the results are sort of complicated, so it's not, like, white, black, white, but, it could be the individual differences of the listeners, of the, stuttering speech. But I would say, many people felt comfortable when they people who stutter disclose their moments of stuttering before their speech, so they would know, okay, this person has stuttering, and well, then let's try to listen to him or something, or we have to listen to the contents of speech or something. So the listeners can get some preparation for the speaker. So but this is not the one answer, I believe, because if a person who stutter don't feel confident, comfortable, if he or she has to disclose, oh, okay, I'm a person who stutter, he or she might want to hide the moment of stuttering. So so of course, the results said, well, it would be better for listeners to do the self-disclosure prior to the speech. But if the person who stutter doesn't feel, or it's comfortable, then we might have to think, how it would be, what kind of, options we can think for the speaker to be comfortably, talk about, his or her speech or something. So, because we always have speakers and listeners, and, we have to consider the relationships, between them. And we also have to consider the speech situation. So if it's going to be the big presentation or just a one-on-one conversation, the situation might be different, and the feelings will be different depending on the situation. So yeah, it was just the one-on-one situation, and especially we focused on the middle school student. And so, that's why, it was one situation. But if we consider the personality of the speaker or listener, or how much the listeners have the knowledge about stuttering, the situation might be different. So yeah, for the future research, well, I would like to do the, how we're going to change the situations so that, the listener's perception might be different, and the speaker's perception aspects, we have to measure it. But, if we do that, then, we can know, we can sort of understand the feelings or perceptions towards stuttering from the speaker side and the listener side together. So, yeah, well, Cynthia, you can do that, right? As your study, one of the studies you can do in the future. So anyway, yeah.
Sure. I think there are many things to consider, as the personality, the situation, but it's an excellent way to educate if the person is prepared and if he feels comfortable about talking.
Right.
Yeah, and it makes feel both comfortable, the listener and the person who speaks, and make them maybe feel more comfortable and reduce or avoid these negative reactions that listeners may have in the situations. It's something to maybe we have to search more about it and to consider many variables, many other things, and well, there's a lot to investigate, to look for.
Exactly.
Yeah. And moving to the last question, are there some programs that are commonly used maybe by speech language pathologists in Japan for treatment, maybe for children, teenagers, or adults who stutter?
Okay, yeah, thank you. Actually, the treatment or the clinical work for people who stutter, we pretty much imported from the United States. So, like a Barry guitar or, Dan Riper, so we pretty much, do the similar or the same approach as the United States. And recently, there is a younger age program from Australia, LICM. Yeah, so LICM approach is becoming popular for younger age who stutter. So one of the institute in Japan has started a training program for speech language pathologists to learn how to use the LICM program for younger kids who stutter. So they get a license. They invite the researchers from Australia or practitioners from Australia, and then they get a training for 3 days or something. Then they get a licensure to provide the services for younger age generation, younger kids who stutter. And so fluency shaping, or maybe mixed methods, or my supervisor used to use a Collins approach. Charlie Healy. So I pretty much support that approach. So especially school age. Even the approach can be applied for older adults or teenagers. So
I think it's good, I think it's better to consider holistic approaches, and so we can improve fluency, and also we can talk about feelings. We have in therapy.
Right.
So people can feel more comfortable about speech and in every situation. And something really important is also the empathy. The empathy of the speech language pathologists. And well, we also use those kind of programs here in Peru. And I think they are something that are very useful for, or I mean, they are very used in all countries around the world. And well, I think we have that was the last question. So finally, I would like to say that there are people who stutter all over the world, and this is essential to know. People who stutter are not alone, and there's a big community to support them, and there are incredible speech language pathologists and researchers that are studying and investigating about stuttering, as Dr. Kawai. And it is amazing how the research in this field is increasing. And in these last years, so we can have more resources to help people who stutter. So these kind of conversations make people more aware about stuttering, and at the same time, we can educate the society, the families, people who do not stutter as we are. And well, thank you for your time. I hope we can meet again, maybe in Japan.
Right. Yeah, definitely. Yeah.
Yeah, thank you. Thank you for sharing your experience, and thank you very much.
Thank you very much.